Hi, my name is Zach Weber, and I'm with Reform Prosthetics. I have a case study I'd like to present to you guys and go over some of the fitting principles that we've designed in this new prosthetic socket that we've built for a patient. This patient's cause of amputation was arterial disease. So oftentimes patients with arterial disease, they have a lot of pain in the lower extremity, or the extremity becomes gangrenous and they have to have an amputation. What's sometimes missed is that sound side has arterial disease as well. So a patient's ability to utilize a prosthesis successfully is predicated on their ability to be comfortable on the prosthesis and promote a longer distance of walking without overusing the sound side. This patient has the ability to walk in the community and over curbs and ramps and steps, but because of his disease does not have the ability to walk a great distance. So this prosthetic design was incorporating ideas that we need to provide stability and comfort and adjustability of the socket to accommodate for the distance he can walk and some potential volume control challenges from this disease. So here's what we've done. We selected a microprocessor knee. This has stumble recovery if he gets a little tired on the sound side, loses his gait mechanics. This knee will provide the stability necessary to hold him up if he trips or becomes fatigued with walking. The other benefit to this knee is it has intuitive stance control. And intuitive stance control basically allows the knee to lock out if you lean into it and pretty much offload your sound side, relieving it of any pressure that's being experienced in the calf. That has been advantageous for the patient as we've been gait training during the test socket phase. The other thing that we've incorporated in this socket is this BOA design, this BOA panel design. You see it cut out in the rectus femoris channel, and you see it cut out in the posterior aspect in the biceps femoris area. This posterior cutout serves two purposes. It's more comfortable when sitting, but as important, if I were to tighten this dial, he can adjust his volume without taking his leg off and adding socks. Further, the patient is known to sleep in a recliner, which is common with patients with arterial disease because they're wanting their blood to flow out of their heart and enter their extremities and avoid that pain, that rest pain. These amputees may experience swelling as a result of that. So if he's a little swollen in the morning, he can basically open up this socket just a little bit wider, not a lot. He can still get into the bottom. He can still wear his prosthesis even if he's a little swollen. So this is the prosthetic design. The patient has done extraordinarily well. He has walked without an assistance during the test socket period. Today we're going to go over some more gait training with him and hopefully get him into a therapy program where he can promote stability and successful utilization with his prosthesis during short distances, understand what those distances are before his arterial disease impacts the sound side. I will follow up with you on the progress of the patient. Thanks.